Hi there, and welcome to this holistic yoga practice video where we're going to take a closer look at child pose. Now, child pose is one of those poses that most people absolutely love. It's really soothing, it's really relaxing. You can get the breath into the back of your body, you get a lovely stretch in the back of your sacrum and in your lower back. Can be blissful, but not everybody finds it blissful. So this video is for you guys. How do we get the most out of child pose if it doesn't feel nice? So we have to make it feel nice. That's the important thing. There are a few reasons why it might not feel nice, and the most important reason that we need to discuss first is because of your back. So if you've ever had prolapse discs or slip discs, they're sometimes called, or sciatica, child pose is a bit of a no-no, practiced in the ordinary way. So it's pretty simple. You don't need any props to practice it safely, but you just need to practice it in a different way. So if you have prolapse discs, this is your child pose. You keep your hips above your knees and come down onto your forearms and rest your head down onto the ground. Make sure most of the weight is coming down onto your forearms, palms are facing downwards. And if you've got a tendency to arch your back, then draw the lower ribs in and make sure that your back is pretty straight so it's not arching too much. It can arch a little bit. But most people, prolapse discs, it will be a tendency to round the back. So this is what we really, really don't want. So you do almost want to come the other way. You want to think of your tailbone lifting, your sit bones widening, and the spine really lengthening and decompressing. Imagine that those vertebrae are moving away from each other, lots of space for those discs. And you can stay here a little time because it's really, really beneficial for offloading your discs, for making space between the vertebrae so there's no squishing of those nerves that come out between the vertebrae. So nice. Good, good, good. So that's your child pose if you have sciatica or disc problems. Now, there can be other reasons why child pose is uncomfortable, and one of them is the knees. So often this compression of the knees as I'm kneeling here is too much, both in kneeling and in child pose. So in this case, you get a blanket and you can pop the blanket into the backs of the knees. And drop back and see if that's enough. And you can rest down into your child pose this way, shoulders away from the ears, feeling your head on the floor. You can also bring your head up onto fists. So one fist on top of the other, like one potato, two potato, if you know that childhood game. And place the top fist, it's sort of resting in between, above and between your eyebrows. So you get a lovely pressure point there called, it's a mama point, which helps to soothe the mind. So you could be here, hopefully that's okay for your knees. If not, you can take more like a cushion. I've got a sofa cushion here. You can take more padding in between your calves and your thighs. Or you can do the previous one where your knees are directly underneath your hips. And another thing you can do is to pop, especially if you're not, I'm on carpet here, but popping something underneath your knees can be really, really good if you have knee pain and you're practicing any kneeling poses on the ground. So do that. So the other reason it might not be comfortable is because of your ankles stretching. And it's great that your ankles are stretching, so we do want to allow some stretch, but not painful. So for this, you might take a blanket and make it a little roll. Can you see how I've rolled part of this blanket? I might actually even make the roll a little bit more delicate. So something like that. And then I pop the ankles onto that blanket roll. And you can kind of assess for yourself. You can go, oh yeah, okay, that supports me enough and I can stretch into that. Or you might be like, oh no, that's still really painful. I'm going to roll that blanket a little bit more. And you can use a towel. If you don't have a suitable blanket, this is quite a thin blanket, it's not a big squishy one. And then rest into your child pose that way. And again, you can use your fists or the backs of your hands to rest on, shoulders away from the ears. And do spend a little bit of time here if you're really stretching into the ankles. It's going to strengthen the soles of your feet. It's going to be really, really beneficial to work through that tightness in the front of your feet, in the front of your ankles. So wherever you are, as long as it's pretty comfortable and you can breathe with it, stay with your child pose a little bit longer because it's so beneficial. That's great. I hope this video helps. If you have any questions or any things that come up for you while doing the video, do put something in the comments and I'll be sure to answer you. I really love answering people's comments. So yes, ask away. Thanks very much. Namaste.